Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to talk to y'all about ashwagandha, which is the Indian herb also known as Withania somnifera. I looked at about 8 studies and 2 systematic reviews of ashwagandha specifically for the use for anxiety and stress. Some of the results I found were pretty surprising, actually. Overall, I was surprised to see that ashwagandha performed pretty well in reducing anxiety and stress. Some studies even used objective measures of stress like serum cortisol or cortisol in the blood, and were able to show that serum cortisol levels even reduced when using ashwagandha. The difficulty with these studies is that they were really small. Most of the studies had less than 100 participants. Most of the studies lasted just for 60 days. And they used so many different types of ashwagandha at different strengths also. So some studies used 125 milligrams a day. Some used 250 twice a day. Some used 1,000, and one study even used 12,000 milligrams of ashwagandha a day. So it was just dizzying to see all the different formulations and preparations, which makes it really difficult to compare them head to head. But overall, what I walked away with was that 300 milligrams of ashwagandha twice a day seemed to have beneficial effects both on stress and anxiety. The way that they measured anxiety is that they gave patients all different sorts of questionnaires, but one consistent questionnaire that seemed to pop up in a lot of the studies was the Hamilton Anxiety Scale. This scale is rated from 0 to 30, but some studies also used the measure of serum cortisol or cortisol in the blood, which I loved that because that's a more objective way to measure stress. And they were able to show even cortisol came down in patients that used ashwagandha. But as y'all remember from prior videos that I've done, the power of the placebo is incredible. And even patients that took a placebo pill still had improvement in all of the anxiety questionnaires, but they didn't see an improvement in their cortisol level, which also was helpful to see that the ashwagandha truly had some sort of effect. As I mentioned, most of the studies just lasted 60 days, and the patients were young. They were all around the age of 40 and healthy. And so that's one thing that I'd like to stress is that if you want to try any sort of supplement, I would be really cautious about interacting it with medication, especially medication that needs to be really tightly controlled, like seizure medication or blood thinner medication or medication for your heart. I would just be really cautious. But after looking at the data, I thought, I wonder if I should try ashwagandha just for 60 days to see if I see any effect. I took the Hamilton Anxiety Scale and I scored a 14, which is on the mild side. But a lot of the patients in the studies also started off with a relatively mild anxiety scale, and it still was able to go down. So I'm a healthy 50-year-old, so I sort of fit into line with the types of the patients that they chose for the studies as well. I decided to go with this particular brand of ashwagandha only because this particular brand was used in one of the studies that I read that had some positive benefits, but I'm not promoting one particular brand or type. I'm not even promoting supplements in general. I just feel like it would be an interesting experiment for me to try it for 60 days and see if I have a beneficial effect. So I plan to take 300 milligrams twice a day for 60 days, and then I'll take my Hamilton Anxiety Score at 2 weeks and then at the end of the study as well. But it's so biased because I know what my score was and I'm wanting it to be helpful. So take it with a grain of salt. This is a very unscientific way to measure if a medication or a supplement is working, but I still thought it would be an interesting experiment. At the end of the day, supplements are so popular, but aren't studied very well. And as I mentioned, there were just so many different flaws in the studies that I looked at. The patient size was really small. Some of the studies even were done by people that worked at the company that was selling the product that they were testing, which is, wow, that's just a big no-no. And the dosing was all over the place, so it's hard to tell, what dose is better than another. But 300 milligrams twice a day seemed to stand out as beneficial for anxiety and stress. So I'll let you know how it turns out in about 60 days. Thanks for joining me.